This is our presentation on adapted physical education, where we will be adapting the sport of soccer into human foosball for students with cystic fibrosis. The overview of our presentation is as follows. First, we will discuss the condition that we've chosen, the sport, the adaptations to the sport. We will go over our entire lesson plan and the sensitization involving this disease. Our group members are Megan Barnes, Olivia Guzzo-Foliero, Morgan McGrath, Megan Sippel, and Katie Spittle. To begin, we will start with our topic, which is cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is a chronic, progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. The main organ affected by this disease is the lungs. The lining can build up with thick, sticky mucus that can be hard to clear, leading to long-lasting and hard-to-treat infections. The body also has a more active than usual immune system, meaning that during lung infections, the body's immune system overcompensates and inflammation is triggered, which can in turn lead to permanent lung damage. There are many limitations to this disease that we must be aware of. For example, persistent coughing with productive thick mucus, wheezing and shortness of breath, frequent chest infections, which may include pneumonia, bowel disturbances and intestinal obstructions, weight loss or failure to gain weight despite an increased appetite, salty tasting sweat, infertility in men and decreased fertility in women, and the inability to be physically close to another CF patient is another limitation with this disease. This is a danger due to cross-infection. For people with cystic fibrosis, being close to others with the disease puts them at a greater risk of getting and spreading dangerous germs and bacteria. This is called cross-infection. Not only are these dangerous germs difficult to treat, but they can also lead to worsening symptoms and faster decline in lung function. The organization we have chosen to support our disease is the Cystic Fibrosis Foundation. You can reach it at cff.org. This organization has a mission to cure cystic fibrosis and to provide all people with CF the opportunity to lead long, fulfilling lives by funding research and drug development, partnering with the CF community, and advancing high-quality specialized care. There is an assistance service offered through this organization called Compass. Many people living with CF and their families face complicated issues related to getting the care that they need. Cystic Fibrosis Foundation Compass makes sure that nobody has to do it alone. Cystic Fibrosis Foundation Compass is a team of knowledgeable and dedicated case managers who can help with insurance, financial, legal, and other issues related to life with cystic fibrosis. Next, we will talk about populations most affected by this disease. Most people with CF are diagnosed at birth thanks to newborn screening. This disease affects about 1 in 2,500 to 3,500 newborns. People with CF have inherited 2 copies of the defective CF gene, 1 copy from each parent. Both parents must have at least 1 copy of the defective gene. People with only 1 copy of the defective CF gene are called carriers, but they do not have the disease. If both parents are carriers of the CF defective gene, the child has a 25% chance of having cystic fibrosis, a 50% chance of not having the disease but being a carrier, a 50% chance of not having the disease but being a carrier, and a 25% chance of not having the disease and not being a carrier. Next, we will discuss medications and aids that help with this disease. Antibiotics are used to prevent and treat chest infections. Medicines are used to make the sticky mucus in the lungs thinner, such as Dornase alpha, hypertonic saline, and mannitol dry powder. Medicines are also used to widen the airways and reduce inflammation. And lastly, special techniques and devices are used to help clear mucus from the lungs, such as active cycle of breathing technique, or ACBT, autogenic drainage, positive expiratory pressure therapy, high-frequency chest wall oscillation, or commonly known as the VEST. There are also several induced risks with physical activity for those with cystic fibrosis. The first would be overexerting the lungs, such as coughing and wheezing. Another would be potential contact with another individual with CF, which we established can be very dangerous. Another would be exercise-induced oxygen desaturation, and another, in more severe circumstances, could be a pneumothorax or cardiac arrhythmias.
Continue blowing, a few seconds more, hang in there, push further if you can, hang in there, keep blowing, blow and empty, big breath back in before coming off again. Off your cup.
My name is Tara Burke, and I'm from Sarnia, Ontario, and I'm 22 years old. Cystic fibrosis is a genetic disorder, so I was born with it. In your day-to-day life, cystic fibrosis would kind of make things more difficult to do your regular activities because your lungs don't function properly. So it's like you've run a 400-meter sprint, and you're at the end and you're kind of trying to catch your breath, and you cannot quite take in enough air at one moment to catch your breath. That's what it felt like to brush my teeth. And your digestive system doesn't work properly, so you have to take pills to help digest your food so that you're getting all the nutrients and the fats out of it. I had a double lung transplant February 1st, 2012. When I was in grade 12, my lung function started to drop, and I ended up spending the next year and a half in and out of hospital. My weight was dropping, and eventually the doctors determined that I was in end-stage function for CF in my lungs, and the only treatment for that is a double lung transplant. Before my transplant, I was doing 6 to 7 hours of treatments a day between eating and sleeping, so that was my entire day. I would say my greatest fear living with CF and transplant is dying young, simply for the fact that I'm huge on family and reaching milestones. I'm the cheesy friend who celebrates every graduation, every birthday, every event that happens in anybody's life. It's hard to not be able to plan for those things because you don't know if you're going to make it to your wedding day or to graduation. So my biggest fear would be, not making it to that point and leaving behind my family and friends to deal with the aftermath of me passing away.
People who have cystic fibrosis say it can feel like you have a stuffy nose all the time or a flu all year round. They also have difficulty breathing, experience wheezing, and a phlegmy cough. All of these symptoms can cause people to feel like they are drowning. One way someone could experience what these symptoms feel like is by plugging their nose or putting a clothespin over their nostril to stimulate a stuffy nose and difficulty breathing. Think back to a time when you have had a really bad cold or flu and imagine what it is like to live with that all the time. To see what it is like to play a sport with cystic fibrosis, you would have a player put a clothespin on their nose while playing a shift. Players will still be able to breathe through their mouth, but they will experience the congested feeling and difficulty breathing that those with cystic fibrosis experience on a daily basis and when they are playing sport or participating in physical activity. The next clip is a woman named Mary Frey who has cystic fibrosis. She has a YouTube channel where she shares her experience living with the chronic illness. This video explains what the symptoms can feel like and how it is to live with cystic fibrosis.
I just feel really out of breath, and I don't know, I've tried to think of ways to describe for people who don't have CF or a lung disease, like what is it when your lungs don't feel great, how to describe that. And the best, one way is like air hungry, that's one way to describe it. And then just this constant, nasty mucus. Anyway.
Lisa Bentley is a former Canadian triathlete that has cystic fibrosis. She competed in many Ironman competitions and has won 11 of them. Her goal as an athlete with cystic fibrosis was to compete in order to give families who had children with cystic fibrosis hope that their child can achieve similar things and still be able to participate in sport and live a healthy lifestyle. Her competing kept her lungs healthy and gave her a chance to motivate others, which she saw as a blessing. She is now a motivational speaker, but her time as an athlete gave many hope that they can still participate in sport and be active, and they do not have to be limited by their disease. Lisa has said that living with cystic fibrosis motivated her to keep competing, but it has not only benefited herself, but it has also motivated others.
Exercise can benefit all patients with CF, no matter what their lung function. Exercise is linked to better maintenance of lung function and fewer hospitalizations. It may help in clearing sputum from the airways, improve appetite, and assist in obtaining optimal body weight. Exercise increases muscle strength and functioning, improves bone health and pain management, and relieves stress. It is recommended that individuals with CF aged 13 to 18 get 60 minutes of physical activity a day. This can include aerobic and resistance training. Aerobic activity should be done for 30 to 60 minutes at least 3 times a week. During aerobic activity, the individual should be breathing somewhat hard but still able to carry on a conversation. This is why we chose for Human Foosball to be 60 minutes in length. This research is from Cystic Fibrosis Canada. For more information and exercise ideas, you can visit Participation or Physical and Health Education Canada.
Today you will meet Michael Caruso Davis, who was diagnosed at birth and has made a choice to not only fight this disease, but to raise awareness and funds for all suffering with cystic fibrosis.
My name is Michael Caruso Davis. I'm 16 years old and I have cystic fibrosis. I'm growing my hair out for lacrosse, you have to get the flow for the season, and if you play lacrosse, you have to have flow. I'm a midfielder, and the reason I'm a midfielder, my coach knows I run a lot, so he put me in midfield because that's all I do is run the whole game. I was 14 when I ran my first half marathon, but I've been running since about 5th grade. I did my first 5K. And I've ran 3 half marathons, a couple sprint triathlons, and numerous 5Ks and just runs here and there. It's just like me when I'm running. No one else, no stress, no nothing, just me. And my doctor always told me that airway clearance is the biggest thing for CF over any medicine.
Yeah, Michael! Yeah!
A while ago, I was diagnosed with AFB, which is microbacteria in my lungs, and I was going to have to get 9 months of treatment. And because of the treatment, I was going to lose my hearing, and there would be many other side effects. And then that summer, I started running a lot. Then we went back to do a test of my lung function, and I went back up into the 80s, which I haven't been in years. So I just kept running since then, and it's been improved. Now I'm at 88. My biggest obstacle when it comes to sports is probably having to get up earlier than everyone else to do treatments before practice. Like, pretty soon coming up, we have practice at 6 a.m., so that means I have to get up at like 4 a.m. to do a breathing treatment before that, when everyone else is still sleeping. When I'm sick, we increase the treatments to 4 a day instead of 2. And I'll either keep my exercise the same or even increase it sometimes, but it never goes down. Because staying active, I found, has really helped me when I'm sick. Yeah, when I'm in the hospital, I've been known to, the minute I get in there, to order a treadmill to have to my room. And I'll run every day just with the pick on in. Even while I'm hooked up, I'll just run. I usually tell people about my CF, usually when the time's right, I guess you could say. I don't jump into it, and I usually try not to wait too long because it's something that I have. I can't hide it for that long, especially if I become really close to them, they're going to find out somehow, so I might as well just tell them and be open about it. Yes, I have a girlfriend. The ones that I've told, they've been very supportive of me, and they don't treat me any different than they would if I didn't have CF, so that's been pretty cool. So CF stands for cystic fibrosis right now, and one day I want it to stand for Cure Found, and that's been a very big motivator. It's something that's inspired me my whole life, and many people ask me, what's my biggest fear? And people think it's dying or spiders or bugs, stuff like that. And I'll tell them my biggest fear isn't dying. It's never knowing what a regular adulthood or regular life should feel like without having CF. Having a normal adulthood to me really means, not having to do treatments or swallow over 40 pills a day, and have frequent hospital visits or stays, and just have CF. I really dream to live a life without CF at one point. My fear as a teenager is missing out on things that normal teenagers would do. If I'm in the hospital, I'm missing out on a lot, either school or parties or things like that a lot of kids are going through that I can't because of CF. The way I get over these fears is really just staying consistent with my treatments, taking my medicine when I need them, never missing out on a treatment, and exercising and really just fighting a lot harder. So whenever I do that and to stay as healthy as I can, it really makes me feel more normal because I don't feel like I have CF all the time. Only like really when I'm sick, and of course I always feel like I have CF because it's something that I have, but kind of mellows it out once you are active and stay compliant with all your treatments and do all your medications that you need. What's next is the Chicago Full Marathon. I've ran 3 half marathons, like I said, but now I've been wanting to do a full marathon for a while, but the New York City you have to be 18, so we finally found the Chicago, which I can run, and it's pretty flat, so it shouldn't be too hard for my first. And the training for that starts in May, so I'll be training all summer for that.
A soccer field would be an ideal environment, but you can adapt human foosball to be played in a wide open, flat area, such as a gymnasium, schoolyard, or backyard. Therefore, human foosball can be played in an outdoor or indoor environment. This adaptation will be designed for those with progressed cases of CF. CF has over 2,000 gene mutations and impacts people differently, since those who have atypical CF or those who have less severe symptoms may be able to play actual soccer. This adaptation will allow those with severe symptoms to play a very similar game and engage in a safe form of physical activity. This allows them to be protected from body contact and will also reduce the cardiovascular impact on their bodies, as they do not have to run across the entire field and can stay in their space on the field. This allows players a fair chance of participating. Due to the fact that the players are not running for long bouts of time, the players have the ability to play the game with an oxygen tank on their back if needed. Due to social distancing measures because of COVID-19, Human Foosball was adapted for 10 participants, which consists of 4 players and 1 goalie per team. This can be adapted to include more players depending on how the pitch is divided. For example, 3 rows would allow for 18 players. This allows for flexibility and gives more people the opportunity to play. If needed, the sport could also adapt to having 2 players per team per rectangle. There are many ways to adapt this sport. A caution to sharing squares would be that players with CF cannot be in the same rectangle. Those individuals would need to be spaced apart as they would be at risk for cross-infection, the chance of spreading harmful germs and bacteria. This bacteria could lead to a rapid decline in lung function, negatively affecting the player. Essentially, the equipment that is needed for a soccer match is a pitch and a soccer ball. The pitch dimensions vary from each ground, but are roughly 120 yards long and 75 yards wide. On each pitch, you will have a 6-yard box next to the goal mouth, an 18-yard box surrounding the 6-yard box, and a center circle. Each half of the pitch must be a mirror image of the other in terms of dimensions. A soccer field is the optimal location because the lines on the field act as guidelines to make the field rectangles used in Human Foosball. Regulation size and weight for a soccer ball is a circumference of 68 to 70 centimeters and a weight of between 410 to 450 grams. The ball should be inflated to a pressure of 0.6 to 1.1 bars at sea level. This is known as size 5. Smaller ball sizes 1, 3, and 4 are also produced. These are designed for younger players or as training tools. You will need 2 soccer nets. The regulation soccer net dimensions are 8 yards wide and 8 feet tall. Players can be found wearing studded soccer shoes, shin pads, and matching jerseys. The goalkeepers will additionally wear padded gloves as they are the only players allowed to handle the ball. Additional equipment that is needed is chalk, paint, or cones to make rectangles, Kleenex, garbage can, water, and benches for the sidelines. Players can also wear a fanny pack with Kleenex in case there's any mucus from the lungs that is alleviated to clear the airway. Safety precautions to consider include heat exhaustion and dehydration. Eliminating the amount of body contact during the sport is important due to a symptom of CF, which is an enlarged spleen. Reducing interaction between players with CF is paramount to prevent cross-infection. It is key to have oxygen and any medications near the field in case an individual may require it. The first thing that comes to mind when you hear Human Foosball may be this. But instead, our version of Human Foosball has more soccer than foosball. Human Foosball tackles COVID crisis. A soccer-starved community in Argentina has found a way around social distancing, inventing a format of the game locals call human table football. Frustrated by the suspension of football, the owner of a pitch in the rural town divided the field into lateral zones much like foosball. Body contact is avoided with players conceding free kicks if they leave their zone. While the 5-a-side format adheres to rules limiting social gatherings of 10 people.
Para los argentinos el fútbol es tan importante como el mate. Nos gusta mucho estar una vez o 2 veces por semana con nuestros amigos, compartir al aire libre, tomar un poco de sol. Si hay una pelota de por medio como el fútbol es mucho mejor y yo creo que el fútbol humano, además de darnos la posibilidad de trabajar, viene a llenar un espacio tan importante como es la vacuna, el barbijo o el lavado de manos.
Soccer is a sport that consists of physical contact and cardiovascular exertion. Therefore, adaptations must be made in order to create a safe playing environment for all CF players. Some adaptations made to the game of soccer to best include players with CF will firstly include walking, shorter shifts, and extra hydration breaks, as well as possible additional salt tablets and allowing for the change of players at any time during the game to avoid overexertion and have proper recovery time. It is critical for players to stay hydrated, and in our adaptations, any player with CF will have a parent or guardian near or on the sidelines to address any of their needs, or an exercise partner with them at all times to check in on the player. Other adaptation rules will include no body contact in order to protect players, and if needed, protective equipment such as chest padding. Also, as much as possible, the ball will be kept on the ground. In the game of soccer, tackling is allowed. However, we are changing this so there is no body contact, as contact sports are risky for players with an enlarged spleen. It's important to remember to always contact a professional to decide what is best for each individual player. Also, check in with a cystic fibrosis physiotherapist about what exercises individual players are able to do, and it is recommended that no sporting activity should be undertaken during infective exacerbations. It is also important to note that players with CF will need to be kept apart in order to reduce the risk of possible infection. Environmental adaptations can also be included by reducing the size of the field depending on the player's different abilities, as well as in an indoor facility, cracking a door open for better air circulation.
Soccer is a game of two teams with 11 players who try to score a goal on the opponent's net without using their hands. Foosball is a game played on a table with small figures, and the purpose of the game is to score on the other opponent's net. Both of these games have similar goals, which is why we chose to turn a game of soccer into Human Foosball. The sport we chose to adapt is soccer. This version of the game follows similar concepts to the game of soccer but is combined with foosball. Combining soccer and foosball makes it a game friendly for individuals with cystic fibrosis. A standard game of soccer requires lots of running and is a contact sport. Contact sports are not ideal for those with cystic fibrosis if they have an enlarged spleen. Some also find exercise to be challenging depending on their respiratory capabilities, so players will not have to worry about overexerting themselves during the game. This game requires less running and there is no contact involved, which is why it is a great sport for those with cystic fibrosis to play, but they are still able to get an exercise and play with their peers. The goal of this game is to create an inclusive sport for children with cystic fibrosis and ensure there is the necessary adaptations needed so they do not have to overexert themselves while playing. This game will also help students develop the fundamental skills needed for soccer, like different footwork skills, passing, and shooting. This game will allow kids to get an exercise in a different way and will be a fun game for all students regardless of their physical abilities. These goals will be completed by reducing the amount of running needed in the game and eliminating physical contact. In order to reduce the amount of running, the field will be split up into different sections for each position, so the field will be set up in a slightly different way compared to a regular soccer game. The game can be played in a gym or in a soccer field. Each side of the field or gym is divided into 3 sections as shown in the picture. One player will go in one square, but more can be added if needed based on the amount of players that are available. The positions are the same as in a regular soccer game, including forward, midfield, defense, and a goalie. There can be anywhere from 5 to 11 players on one team, and the game is 1 hour total with 30-minute halves. Shifts in a game are typically 5 minutes, but players will have the ability to sub any time if players want a shorter shift, and there is also a 10-minute break in between halves so players get a chance to rest. Players are to remain in their designated section for their position without going into other sections while playing. The ball is allowed to cross past the lines, but players should try their best to not let the ball get past them to avoid the other team scoring on their net. If the player moves into any other player's section during the game, the opposing team will receive a penalty kick. Players should also try their best to keep the ball low when kicking and avoid hitting other players with the ball to limit the amount of contact. Players are not allowed to touch the ball with their hands but are able to use their chest or head to hit the ball, but it is best if players only use their feet to hit the ball. If there is more than one player with cystic fibrosis, make sure that they are on separate teams or 5 feet apart from each other at all times, or on the field at separate times to avoid cross-infection. Players will arrive at the gym or field and change into their activewear if needed. If there are multiple players with cystic fibrosis, make sure that those players are aware of each other and avoid going within 5 feet apart from each other. The players will then be split into 2 separate teams and be given pennies or jerseys indicating the team that they are on. The rules of the game will also be explained to them, and they will be given their positions before the game starts. The coach should make sure that there is all necessary equipment needed and have the gym or field set up before the players arrive. The coach should also check to make sure that any student with cystic fibrosis has their puffer with them or has their medications with them, and ensure that there is tissues available for the students.
Play Human Foosball. The field is divided into rectangles using chalk, spray paint, or cones. The field is divided up into 21 boxes, which would allow for a match of 10 on 10. The rules of Human Foosball include 1 player per rectangle. The ball is allowed to cross the lines, but the player is not. All other rules of soccer apply. Some rule adaptations to soccer include leaving one's section results in a penalty kick, and there is no offside. The rules of soccer are followed in addition to the foosball portion of being in a designated area of play. The aim of both sports is to score more goals than your opponent. To score, the ball must go into your opponent's goal. To win, you have to score more goals than your opponents. Players must use their feet to kick the ball and are prohibited to use their hands apart from goalkeepers, who can use any part of their body within the 18-yard box. If a ball goes out of play on a sideline, then it is given as a throw-in to the team who did not send the ball out of play. If it goes out of play on an attacking player on the baseline, then it is a goal kick. If it comes off a defending player, then it is a corner kick. There will be no offside rule due to the adaptation of the pitch dividers. The modified game emphasizes passing and shooting over running and fancy footwork, and of course there are no rough tackles. These adaptations eliminate end-to-end single players and allow for more team inclusion. Human Foosball can have applications beyond lockdown for youth development and for players with mobility or cardiovascular problems such as CF. To play Human Foosball, the players hit the field, each claiming a rectangle. There is some strategy to which rectangles players can occupy, similar to foosball. Goalies will be the closest to the net, then defense, offense, and midfielders. The match will consist of 2 30-minute halves and a 10-minute break, with unlimited substitutions. A kickoff from center will determine by a coin flip will commence the match. Variations to keep flow include changing the number of players and field dimensions, the way the field is divided into rectangles, which team occupies rectangles, could do rectangle rotations as in volleyball, or implement a rule of 3 touches to keep the game moving. The variations are endless. A warm-up activity prior to the game is called tunnel tag. To begin, have players divided evenly into 3 of the rectangular boxes in the middle of the field, since they are the largest. Have all the players with a soccer ball dribble the ball and try to keep control of their own ball away from the coaches, who will be trying to tag players. Once a player is tagged, they must stand with their legs apart and hold the ball over their head. The only way to get back in the game is by one of the other players dribbling their ball through your legs. This drill can be done at a walking pace or light jog to not overexert players. This drill focuses on keeping your head up, having awareness of your surroundings, and ball control. Play this activity for about 3 to 5 minutes to get players moving and their heart rate up. The standing posture of feet wide apart and ball overhead is a good stretch for the legs, back, and arms. This also gets players used to playing within the designated playing area. Following the time allotted for the game, have players remain in their rectangles. The player with the ball will pass it to anyone and then follow their pass by walking to that player's position. The player receiving the pass will continue the drill by passing it to another player and following their pass. Multiple balls can be added to increase the amount of walking. While players are waiting for their pass, they can perform static stretches. This will continue until the player's heart rate and breathing rate have returned to normal. Players will then hit the sidelines for water and electrolyte replenishment. The main goal of this adaptation is to modify soccer to include kids with CF and teach kids how to play the adapted sport while ensuring their safety. The goal is to adapt soccer to human foosball. This will encourage kids with CF to engage in low-impact physical activity. This will bring a sense of community and inclusion. The objective of this is to focus on the fundamentals of soccer. This allows for the development of skills without the heavy cardiovascular impacts that come with the sport. This will be achieved by eliminating all body contact between players, reducing running time, and mastering the footwork skills to play well.